Hi, my name is Cloud. This is me enjoying my runs and the best gifts of life with my ladies. I'm a Jeeper at heart too. Welcome to my channel dedicated to recovery, rehabilitation, and running. Thank you for joining me in this journey to recover from the big C, and hopefully one day soon, run again. Today marks 5th Saturday following my surgery. I had a procedure.
Heart rate 111.
Video assisted thoracic surgery for the removal of the right lower lobe on the right side of my lung. And it's been about 5 Saturdays since, and it's been a process to recover, and this has been the single biggest thing that I think I've been doing to try to get myself back together following my surgery. And I still get these bronchospasms off and on that you might hear from me, especially when I talk a lot. That's why I wasn't able to document this sooner than possibly today, because of these spasms. And along the way, I intend to share with you my experiences from day one and my background.
Heart rate 108.
And hopefully you can glean some insights that you can use towards your own recoveries. But for today's program, today's plan is to complete this 1.5 mile walk. And that's the best that I can do for now. I'd like to get to the point where I can run again, because I used to run. Not professionally, but just very mediocre, very middling running skills. I did a half marathon technically about a year ago, and the intention this year was to actually do a marathon, but obviously life has a way of throwing a curveball at you from left field, and you don't necessarily
Heart rate
see coming.
112.
Anyhow, right now I'm at about a mile into this 1.5 mile walk, and I try to get in two to as many 3 of these in a day as part of my rehab, as part of my recovery. My current heart rate right now is, I think, is 115, 116 beats per minute at a very, very snail pace of 27 minute a mile. A couple of deep breaths, and I'll get back to you as soon as I formally hit my 1 minute marker. All right, coming up on my mile marker, right next to this Jeep right here. Not overly winded, but I can feel myself taking deep breaths. And my current metrics is exactly a mile. It's been about 29 minutes and a half total walk time for the 1 mile. Heart rate is 116 at a pace of 30 minutes a mile. A far cry from my running days, but hey, I guess every day can be a little better each time, right? One more lap to go. Let's get to it. So along the way, as I mark through my daily activities, I'd like to invite you to join me on this journey. Talk about, the entirety of this big C that I've been on. It's been a roller coaster ride these past few months.
Heart rate 114.
That's where I want to be heart rate wise. I don't want to bite more than I can chew. so I gotta slow down at times. Anyways, anywho, so my journey officially started the end of June of this year, 2025. It was an incidental finding, a very innocuous X-ray screen that I undertook revealed I had a small nodule, they called it, in my right lower lobe of my lung. Turns out that anything more than 3 centimeters really isn't a nodule anymore. It's technically a mass. Go figure. Anyways, I got referred.
Heart rate 111.
I got a consultation with a pulmonologist, and then I was recommended to get CT scans, which came out a lot more distinctive on what the nodule looked like, and I was referred to get a PET scan, PET. It's like a CT scan, but they inject you with some kind of a dye that they can see, and the dye lights up on the site where there is cancer activity. So I got that done, and from that it lit up. I was hoping it wouldn't light up, but it lit up. Oh well, what can you do? So it lit up. Doctor called me that well,
Heart rate 117.
we gotta find out why it's sort of lit up. It wasn't lit up. It was, by their standards, it was a 2.9. So that's a unit of measurement that they use to show how much lit up the site was. Anything normal would typically be about 2 or less. Anything more than 2, they start to ask questions why. Anything more than 5 really is almost definitive that something is going on there that's potentially malignant. But since mine was 2.9, it was sort of lit up, but it wasn't significantly lit up through their scans. Anyhow, so he then said, well, we got to make sure what it is. So now he's saying, let's get a lung biopsy. So for that procedure, I had to go into the
Heart rate
hospital
116.
where they inserted a long needle into my lung to take some samples. They didn't really have to sedate me, just a lot of topical, pain lidocaine, I think is what they used to help with the entry of the needle, but it wasn't too bad. It was a little uncomfortable, but it wasn't crazy. Something you can easily handle. Any grown person can anyways. So as I continue on my story, they took the samples, then took them about a week to confirm, and the confirmation, they called me and said, yes, it is malignant. The official diagnosis was lung adenocarcinoma.
Heart rate 113.
Okay, that heart rate sounds good. Anyways, well, lung adenocarcinoma. So then the doctor said, well, we've got a few options. We can either do a radiation therapy or take it out. But since the best outcome is really through by taking the mass out is the best recommendation. So I decided not to do the radiation therapy. I decided to do the removal therapy by way of a procedure called the VATS, Video Assisted Thoracic Surgery. It is a major surgery. Let me put it that way. It's been a major recovery, to be honest
Heart
with
rate 117.
But the procedure nowadays,
Lap 5 711.
is so much better than what it was 10, 20 years ago, where to undergo this kind of procedure to remove the offending tissue in your lung, you had to do an open thoracic surgery. And recoveries for those were horrendous, to say the least. In my case, I was at the hospital. One thing I didn't anticipate, though, was the pain. I thought I could easily handle the pain. Oh boy, I was wrong. I need to concede that. So I was at the hospital about 4 days, in a lot of pain, short of breath, uncomfortable, couldn't roll, didn't know where to lay.
Heart rate 117.
First day I was out of it right after surgery. The second day I was barely awoke, only awake enough to report I need my pain meds, which initially I struggled a lot, because every time the nurse came around to ask me how's your pain, I'd be like, oh, the pain is okay, I can handle it, it's like a 5 out of a 10. And then my blood pressure was like 190 over 110, severely short of breath. And she's like, no, it's not, you can barely breathe and your pain is horrendous, it's got to be 10 out of 10, and you need to tell me that so I can give you your medication properly. So I was like, I quickly learned right away that no, it's not a 5 out of 10. I think it's a guy thing. You know, men, we have a tendency to discount
Heart rate 116.
The things that we feel, the pain levels. When you're laying in the hospital needing pain medication, I think you need to be honest about how you feel. Anyhow, I went home 4 days after, and this journey of recovery started for me at home officially September the 1st. And this has been my biggest go-to, is to walk as many times a day as I can, to get my breathing back, to get my my energy back, to help with the pain. And walking has been it, which I intend to turn into a run, hopefully soon when the time is right.
Heart rate 114.
Almost there, coming up on 1.5 miles for this morning's training regimen. Running, walking at a snail pace of 27 minutes a mile at 115 beats per minute. Slow cadence, focusing more on breath,
Heart rate
breathing.
118.
Oh, heart rate spiked up a little bit. As long as I'm under 120, 150, 120, that's where I want to be. But for today, my first morning walk of the day, I'm almost done. And I'll be doing another of these. Second episode, walk, rehab, recovery from cancer. By mid-morning, and then one more in the afternoon. So about 3 events for the day. Far cry from what I was capable of doing day 1 when I first started walking. And for day 1, all I could do was just really walk around the house. Distance wise, I did 10 laps of 20 feet.
Heart rate 116.
200 feet worth of walking when I first got home 4 days after surgery. And I would do that about 3 times a day. And that's all I could do for the first week. And now I'm getting to the point where I could do 2, maybe 3 miles a day at broken up into 2 or 3 walks at a very snail pace. I know this is gonna take time. I have to keep reminding myself to be patient about recovery. And you know, there's a lot of physical healing from the surgery and from the big C, but there's also a lot of emotional healing that I have
Heart
to be
rate,
honest with myself.
114. Lap 6,
And for
655.
At this particular point in time, learning to trust my body is a big thing. Learning to trust what my body can and cannot do is something I have to learn to adjust to. Anywho, thanks for following me in my journey today. And more to follow, more information, more things I'd like to share with you. Hopefully you find this resource, first of all, helpful, second of all, interesting. Have a great day. Bye.